Navigating the healthcare landscape, essential regulations. The world of healthcare is bound by a critical set of rules and regulations.
These rules ensure patient safety, privacy, and ethical practices within healthcare organizations. Think of these regulations as the guardrails guiding healthcare providers, hospitals, and other related businesses toward responsible and compliant operations.
One of the most recognized regulations is HIPAA, the Health Insurance Portability and Accountability Act. HIPAA focuses on protecting sensitive patient data like medical records and personal information.
Then there's OSHA, the Occupational Safety and Health Administration. OSHA sets the standards for safe and healthy working conditions for all employees, including those in healthcare settings.
We also encounter the Stark Law and the Anti-Kickback Statute, both designed to prevent conflicts of interest. The Stark Law specifically addresses referrals for designated health services. It aims to ensure that medical decisions are driven by patient needs rather than financial gains.
The anti-kickback statute goes hand in hand with this, prohibiting any form of remuneration in exchange for referrals of services covered by federal healthcare programs.
These regulations may seem complex, but they are essential for maintaining a trustworthy and ethical healthcare system. Understanding their implications is crucial for anyone involved in the healthcare industry. In the following sections, we'll delve deeper into each of these regulations, providing clear explanations and practical examples to guide you toward compliance. Safeguarding patient information, HIPAA, and data privacy. In an era of digital health records and interconnected systems, protecting patient privacy is paramount. This is where HIPAA takes center stage.
Enacted in 1996, HIPAA has become the cornerstone of patient data security and privacy in the United States. HIPAA's primary goal is to safeguard protected health information, or PHI, which includes a patient's medical records, billing information, and other identifiable health data.
This means that healthcare providers, insurance plans, and any other entities handling PHI must adhere to strict guidelines for its use and disclosure.
One of the key requirements of HIPAA is obtaining patient consent before sharing their PHI. Patients have the right to access their medical records, request corrections, and control how their information is used for marketing or fundraising purposes.
HIPAA also mandates that covered entities implement administrative, physical, and technical safeguards to protect electronic health information. This includes measures like access controls, encryption, and audit trails to prevent unauthorized access and data breaches.
The digital age has amplified the importance of HIPAA compliance. With the increasing use of EHRs, telehealth platforms, and mobile health applications, healthcare providers must be vigilant in safeguarding patient data from cyber threats. They need robust security protocols, employee training programs, and incident response plans to mitigate risks and maintain patient trust.
Fostering a secure workplace. OSHA guidelines. Workplace safety is not just an ethical imperative, but a legal requirement.
In healthcare settings where employees face unique risks from exposure to infectious diseases, hazardous chemicals, and workplace violence, OSHA regulations play a vital role in protecting their well-being.
OSHA standards cover a wide range of workplace safety aspects, from hazard communication and personal protective equipment to ergonomics and fire safety.
For example, healthcare facilities must have a written hazard communication program that identifies potential hazards, provides training on safe handling procedures, and ensures proper labeling of hazardous materials.
OSHA also emphasizes the importance of preventing needle stick injuries, which can expose healthcare workers to bloodborne pathogens like HIV and hepatitis B.
Employers are required to provide safety-engineered needles, implement safe handling practices, and offer post-exposure prophylaxis to minimize the risk of infection.
Another critical area addressed by OSHA is workplace violence prevention.
Healthcare workers are at a higher risk of experiencing violence from patients or visitors, and OSHA encourages healthcare facilities to develop comprehensive workplace violence prevention programs. These programs typically include risk assessments, employee training on de-escalation techniques, and security measures to deter and respond to violent incidents.
By adhering to OSHA standards, healthcare organizations can create a safer work environment for their employees, reduce the risk of workplace injuries and illnesses, and ultimately improve the quality of care they provide.